Did you tear your ACL? Are you wondering if you're going to need a brace following your ACL tear, or if you ended up having surgery, do you need a brace? Stay tuned because we're going to be talking about those two things. What's good, Hoopers? My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist, and co-founder of the Basketball Doctors, alongside with Dr. Gabe Ignacio. Our goal for the Basketball Doctors is to empower the basketball community with evidence-based information regarding rehab and performance for basketball athletes of all ages. This information is just for educational purposes, not medical advice. If you need medical advice, seek out a healthcare professional or send us a DM and see how we can help you. So let's jump into our topic of should you brace after ACL tear or after ACL surgery? All right, so you tore your ACL and now we got to figure out if you're gonna need a brace. That's one of the most common questions we get. Do I brace after my ACL tear or after ACL surgery? So if you want to learn a little bit more about ACL tears, check out the video above. Gabe gives a breakdown of what an ACL tear is and what you need to do after an ACL tear. So we're gonna start off with the first point. So let's say you tore your ACL and you haven't had surgery. Do you need a brace? So the brace is really good for giving stability. So if you tore your ACL, one of the factors on whether or not you should have surgery is instability. So the brace is gonna provide stability to the knee. So if you're feeling episodes of your knee giving out, a knee brace would be helpful because a knee brace is gonna help protect the knee from those giving out episodes. Because if you don't have the ACL, which is here in this ligament, you might have signs of instability. So when you're running, cutting, or anything, because you don't have that stability through the ACL, the knee might pivot or give that feeling of instability. So that brace kind of helps prevent that rotation or hyperextension movement. However, if you don't have the feeling of instability and your quad's strong enough after you tore your ACL, you don't need a brace. You're classified as a coper, and we have a video on that, whether or not you should have surgery following ACL. But the biggest one that we encounter is after surgery. So let's say you tore your ACL, you had ACL reconstruction, either with different grafts or, either patellar tendon, allograft, or whatever of your choice. After you have ACL surgery, the biggest thing is usually, right now there's a big debate on whether to brace after surgery and whether not to brace. Usually we see a brace in the first week after surgery. And the reason we have the brace is whenever you have surgery, you have inflammation and the quad stops working as much. And also it's still not strong enough overall. So you might have feelings of it giving out just because the quad's so weak. So that brace is gonna give it stability and help protect the knee. Because if the knee gives out on you, the graft is there's a new graft, you have a new ACL, it might put some strain on there. However, there's some surgeons that right now are not giving brace after surgery. They'll give you a straight knee brace, but they won't give you a functional brace because the research right now shows that it's not as beneficial having a knee brace. They kind of want you to activate your quads, but you need to be using a crutch when you're walking and everything. So that's kind of like the main thing. So we normally, in our opinion, we recommend having a brace in the first week or two, just to give you just confidence to be able to kind of start doing more exercises, trusting in your knee, because once you have that surgery, you're not gonna feel too confident in being able to walk or just trusting your knee, so your knee might kind of give out or something like that in regards to that issue of instability. But there's no true instability, but it's just a quad not working and not controlling that knee. But the biggest question we get is, do I need to wear a brace after I go back to sport? And it depends. So if you're going back to the sport, let's say less than 12 months, between the 9 to 10 month mark, which we don't recommend. We recommend more, at least towards that 12-month range of going back to basketball, full contact, or any sport that you want. But if you have to go between that 9 months to that 12 month, that's when I would recommend using a brace, because usually what I've seen people, when they try to rush the process, you're gonna need the brace to kind of help you, give you that added base of stability, but we don't recommend it. We recommend you to go through the full rehab process and not use that brace when it's that 9 month, because usually when you've seen people, and when I've seen people playing basketball or any other sport with a knee brace following ACL surgery, they just don't look like they're ready to go back to sport. So the knee brace is kind of just like a little boost that they're trying to use just so they could get back earlier. So we recommend not using the brace and just getting back to your normal rehab timelines and get back to sport. However, we do recommend a brace if you're going to a contact sport, like let's say skiing, because skiing actually shown research that a brace would help. And then football, sometimes we recommend it depending the position. Maybe quarterback, usually they recommend that. However, for basketball, we just tell people normally if you go through your entire rehab protocol, you'll be back playing basketball around that 12-month mark, fully contact. You don't need a brace because you're strong enough there. And they've shown too, research, once you have a brace, that compressive factor actually limits the quad from firing. So when you're gonna land and everything, it's gonna affect your ability. And personally, when I tried the brace on, it doesn't feel as great. It limits your ability to cut, do certain movements, and it might put you at risk for your opposite knee. So kind of take home message, I would say it depends on your situation. But if you have to wear a knee brace, it would be towards the late stage. But normally, like I said, if you trust your rehab, do well rehab, you don't need a brace at all. Only in the beginning, that first week. But if you really want to get back earlier, you could use it in that late stage return basketball. All right, guys, thank you guys for watching. Hopefully you guys learned a thing or two regarding bracing following ACL surgery or ACL tear. If you liked our video, please hit the like button and subscribe, and please share it with friends and family so we could share the content of our videos to everyone that we can help. And if you didn't like a video, hit the dislike button and tell us how we can improve the delivery or the content of our videos. We are the Basketball Doctors. Let's ball for life.